Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
This is Dr. Angela, everyone's favorite OBGYN, and I would like to welcome you to episode 6 of the Ask Dr. Angela podcast, where we discuss things ranging from fashion, family, politics, and a sprinkling of medicine to top it all off. I keep it light, I keep it fun, I keep it very simple. Before we dive into things, I would like to thank you, the listener, for joining us on this evening's podcast. Today's question comes to us from Nancy.
How often is it recommended to get a pap smear if you've had a normal one in the past?
Nancy, this is an excellent question, and quite frankly, it can be a bit confusing, especially since I feel like the screening guidelines for pap smears change every 6 months or so. I mean, it just seems like yesterday we were saying, HPV testing, no HPV testing, pap smear every year, no pap smear every year. I can imagine that it's equally as confusing to you because it gets to be a little bit confusing for me, and I'm a board-certified OBGYN. So in answering your question, I'm just going to go over the basic screening guidelines at present. And notice that I said at present because certainly these are probably subject to change within the next couple of months or so. With the trend over the past couple of years, I would not be surprised if they did. So let's start with this. First of all, we do not do screening on women younger than 21. No pap smears on anyone that's younger than 21 years of age. Certainly, if you do happen to be under 21 and are sexually active, we are screening you for things like gonorrhea and chlamydia. If you fall between the ages of 21 and 29, the guidelines are recommending that you get a pap smear every 3 years. Again, between the ages of 21 and 29, the American College of OBGYN is recommending a pap smear every 3 years. That's a pap smear alone, no HPV testing. If you fall between the ages of 30 and 65, you can have one of two things done. You can either have just a pap smear alone and get that done every 3 years, or you can have co-testing, which is actually the preferred method, and that includes not only a pap smear, but also screening for high-risk HPV. And if you do this co-testing, you can have this done every 5 years. In women that are over the age of 65, no screening is necessary after you've had adequate negative prior screening results. If you've had a history of a hysterectomy for a benign reason, and by benign I mean, conditions like fibroids, heavy periods, but no history of any kind of uterine or cervical cancer, then once you get your, uterus and cervix removed, there really is no further need for a pap smear. I mean, after all, pap smear screen for cervical cancer. If you don't have a cervix anymore, what are we screening for? I can't tell you the number of women that I see that, have undergone a hysterectomy, yet they continue to be screened with pap smears. So Nancy, I hope that going over these guidelines has provided a little bit of clarity to the whole pap smear topic. It certainly is and will continue to, I'm sure, remain a hot topic. Thank you so much for submitting your question. And because we did feature your question on today's podcast, my assistant will be reaching out to you, and we will be sending you an official Ask Dr. Angela t-shirt. It's a pretty bomb-ass t-shirt. I'm actually wearing one right now. For those of you that are listening and enjoying the show and want to have your question featured on the podcast, please go to my website. That's www.askdrangela.com. That's askdrangela.com. I would love to hear from you. We've been getting so many questions that it's becoming increasingly difficult to choose which one to feature on the show. So please keep those questions coming. In closing, an inspirational quote by an unknown individual, but it states, "Always concentrate on how far you've come. rather than how far you have left to go. Until next time, look better, feel better, be better. I'm looking forward to reconnecting with you in the next episode of Ask Dr. Angela. Have a great evening.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.